Welcome everybody to our 10th webinar. This is our 10th webinar, and we are happy for you to be part of this. Not sure if the live webinar might be working, but no, it says it is live streaming. Oh, it's preparing. Okay, it's preparing. All right, so we're figuring all these things out, and it will go live. It's still saying preparing for some reason. It isn't another way. So welcome everybody. We're going to get started. For those of you who still need a Spanish translation, you can do so by calling the number that is listed in the chat. And we're going to be talking today about two statewide surveys that have been conducted by Disability Voices United and the State Council on Developmental Disabilities. You will be able to ask questions of any of the panelists through our chat function and through our Q&A. So right now, Ed, I'm noticing that one of our panelists has dropped off, and so I'm going to just ask her to rejoin us. I'm not sure what's going on with her, and we will continue on. Okay, so first of all, I want to let everyone know some sad news that we have been informed about, and that is that we just learned today that one of the champions of self-determination in the state of California has passed away. Her name is Cheryl Hewitt. She was a self-advocate living in San Jose who was the chair of the San Andreas Regional Center Local Advisory Committee. She was also part of self-determination in the state of Michigan where she lived before she moved to California, which made her such a champion because she knew personally how much this changed her life. Unfortunately, Cheryl did not get picked for self-determination in the first round, but did get picked in the second round in November, but was never able to enter the program because there were so many barriers put in her way. And we will miss her greatly, and we hope that she lives in, she rests in both peace and in her incredible spirit that she always had in fighting for self-determination. So we're gonna now get started. I'm going to share my screen with all of you because we have some announcements. Wanted to talk to you first about what's going on in our community around the budget and about some requests that we are making in order to, move our community forward. So let me start by sharing my screen. So first of all, I just want to remind everybody that you can find lots of information that we have collected on coronavirus, and we've created a lot of resources ourselves. You could go to our coronavirus resources website at disabilityvoicesunited.org/CV. You can also join our mailing list by going to tinyurl.com and join DVU mail. If you get on our mailing list, you're going to be able to learn about all of the important information that we can provide for you and get our action alerts. I wanted to also let everybody know something that Disability Voices United, the State Council on Developmental Disabilities, Disability Rights California, and at least 30 other organizations are calling for in the state of California. And I would, I'm hoping that, if I could ask all of our speakers to mute their computers so that we're only hearing my voice at this time. We're going to, one of the things that we're calling for is increased flexibility in order to, and choice during this time of the COVID crisis. So we have introduced some language to the legislature allowing all people on the self-determination waitlist to enter by July 1st, 2020. We believe that this crisis has really created some instability within the developmental disability system. People are having a hard time finding staff to support them, keeping staff. And we believe that this creates a huge health and safety risk if people are not able to find support. We also know that we know from 2009 that participants were able to better weather budget cutbacks, and we know that budget cutbacks are coming. And so we hope that you will join us in our quest to expand the mailing list and expand the self-determination program. Now going to what I'm going to do is to ask Ed to please, while I do my presentation, to be monitoring chat and the Q&A, because for some reason I'm not able to look at the Q&A very well right now. So I appreciate that. So now we're going to get started with the first part of our presentation, which is the presentation of our survey. We have been conducting a survey from the middle of April to the middle of May, asking people with disabilities, all disabilities, and their family members how they've been impacted by the coronavirus pandemic and the ensuing shutdown. And these are the final results because we are going to be closing our survey. First of all, just to let everybody know, there were 435 responses to our survey. 13% of those were people with disabilities, 87% are family members. We had a lot of really great responses from people with disabilities, and we were really pleased about that. The range of disabilities that people experience are extremely wide. I mean, not only all of the developmental disabilities that are served by regional centers, but people who are blind with low vision, are low vision, deaf, or hard of hearing, physical disabilities, mental health disabilities, chronic illnesses, really a wide range of disabilities represented. As reflected with most people with disabilities, they live with their families. They reported living with their families. 8% live in their own place without support staff, 7% in their own place with support staff, and 3% with others in a group home or facility. The racial and ethnic makeup roughly reflects the state of California, although some areas, some are underserved. We had a very large contingency of almost 17% of people who checked other or didn't answer their ethnicity. So I think that's one of the reasons. So it's possible that they are multiracial, some of them. But we had 34.8% of our respondents are Latino versus about 39% in the state of California. 33.5% reported being white, and the population in California is 36.8% of whites. Blacks, we had 7.3%, which is pretty close. The African-American population in California is 6.5%. Asians are actually very underreported. We had 6.2% of Asians in our survey, but there's actually, the population is 15.3% in California. Native Americans, pretty close. American Indian population is 1.6%. In California, we had 1.3% of our respondents. Because the space that Disability Voices United works in is primarily the developmental disability world, that is that seemed to be the largest area of respondents, so the largest disability area. 84% of our respondents said they have a developmental disability. Many of them are dually diagnosed with other disabilities as well, and that they qualify for regional center services. We received responses from consumers of all 21 regional centers. We had some underrepresentation, most blatantly from the Inland Regional Center. We had about 10 respondents, and they are by far the largest regional center with about 35,000, I think, consumers. And so that is an area that we really want to reach out to and explore to see how they're doing. It's often very underserved communities. For those of you who don't know what a regional center is, I'll just quickly tell you that they're nonprofits contracted with the California Department of Developmental Services, and they provide service coordination and funding for people to get services who have developmental disabilities. Regional centers have told the legislature, have told the state that they have reached out to almost all of their clients, and some of them are saying 100% of their clients. But that doesn't really jive with what we've been hearing. And by the way, these results have been, the other surveys have asked the same question, and the results are similar. 42% of our respondents have reported that they have never been contacted by the regional center. 60% reported that they tried to reach out to the regional center and ask for special help during this crisis, but a quarter of those hadn't gotten a response, meaning they asked for something, they were either denied those extra services, or they were denied, or they haven't gotten a yes or no answer yet. We believe this is really a significant problem. We believe that individuals are going to fall through the cracks if the regional center does not reach out to them. We are also calling for regional centers to not just have one contact, to really have, first of all, a quality contact with families and individuals, so that it's not just, oh, I sent them an email, they didn't respond, but I call that a contact, but a really quality contact where they ask them, multiple questions about how they're doing, not just, how are you? Because lots of people respond, we're fine. But then when you start digging deeper, you find out that maybe they don't have money for food. Maybe someone developed COVID and they never even told them. So they never told the regional center. So I think they need to dig deep. They also need to have repeated contacts with regional centers. Their regional centers need to have repeated contacts with their clients and families. I can tell you that my regional center did reach out to me proactively, but that was 7 or 8 weeks ago now. And they don't know what could have happened to me in the 7 or 8 weeks. You can't make it incumbent upon a family to reach out, especially if they're in a crisis. We asked them if they needed more services, and 40% said that they have needed more services during the pandemic, but 47% of those services have not yet been received. No response. They were told they had enough services. They were denied because you have enough services, even though a lot of families are having to do double duty now because their children are not in school. They also said that one of the reasons they can't get services is because they can't find staff who are willing to come into their home. What we found is Latinos have a much greater need for services. 52% of Latinos reported that they asked for more services. And as you can see from this chart, it was much lower with the other ethnic groups. People are in need of support, but they're afraid to have that support in their home, which is causing a lot of crisis for families. You're going to hear some examples of this as we get into putting a human face on these statistics. 54% reported that they have concerns about having support workers in their home. They have a fear of being exposed to the virus. There's a person in their home is medically fragile. They have no personal protective equipment. The person with the disability will not wear a mask, and therefore they are not protecting themselves as well. And they have staff who's just not knowledgeable about keeping safe. One area that we have a lot of concerns with, and we know that the Department of Developmental Services has issued a directive on this, is that California, at the beginning of the COVID crisis, agreed to continue to pay programs, particularly those congregate programs that are outside the home, like day programs, work programs, who are experiencing absences due to COVID, either absences of consumers because they've had to shut down, or absences of staff. And but there is this expectation that they will continue to provide services in person or remotely. However, when we asked the subset of people who use day programs in our survey, if what's going on with them, 45% report that they attend a congregate group program, day program of adults, and of those, 93% said their day program was completely closed. But only 51% said they were continuing to receive any kind of services. And we know that these services can really be varied, including having someone in your home. I have a son who's 23 years old who continues to receive day program services on an individual basis in our home by a staff member. So it can be done. They can go on socially distant walks. They can hang out in the backyard. They can, so there's lots of ways to have person-to-person supports. You can also do things online. You can help them with grocery shopping. You can help families in so many ways. But by the way, the programs are still billing, which is obviously a real concern now that we are having budget cuts. We also asked about special education to about half of the respondents report having a child with an IEP, and the other half were adults. Of those, 49% were not receiving the education services in their IEP since schools closed. And there's a lot of various reasons for that. 16% said they didn't have access to a computer or device to receive special education services, which is obviously a huge barrier to accessing education. Other reasons include that there's no direct teaching even remotely, like the teachers are just sending home worksheets and basically no teaching is happening. The speech therapy through telehealth has still not been approved. It's taking over a month for a teacher to even contact a family. We're hearing very consistently that students are having a hard time sitting for online learning, and no schoolwork is even provided. They're just saying, here's a couple of websites, go through those. Or the student is non-speaking and can't participate because they don't have their traditional communication supports. About 14% of our respondents said that they were part of the self-determination program. And a lot of those have faced, as we know, a lot of barriers to get into the self-determination program for several years now, but things have just gotten worse. They're not getting responses from their regional centers. They can't get their budget certified. They're afraid to get their staff fingerprinted because they feel it's dangerous. They are afraid of having virtual person-centered plans because they don't think it's going to be valid, and that their independent facilitators are not getting paid. So we have really significant concerns and are working to try to reduce those barriers. The families are not prepared for COVID-19 if somebody gets infected in their household. 39% report of all of our respondents, they don't know what to do if someone in their household gets infected. They don't know the measures to take. 44% have no one to care for them if they get sick, that they're just going to be on their own. 35% have no access to personal protective equipment like gloves and masks. And these concerns are far greater in the Latino community. So as you see in these charts, 52% of Latinos report that they don't know what to do if someone in their household gets coronavirus. It's much higher than in other ethnic communities. Latinos are also less likely to have someone to care for them. They live in much bigger families and have much more concerns that they're not going to have anybody to care for them if they or their loved one gets sick. And finally, fewer Latinos have access to personal protective equipment in their home, much, much less than whites. There's also extreme worries about getting access to appropriate health care during this time. 67% are worried that their family member won't get this appropriate medical care. 54% are concerned about having staff in their homes to help them if they're sick. Their specific concerns are related to not being allowed in the hospital with a family member, which we reported, by the way, a couple of weeks ago that the state of California did issue a directive to hospitals saying that people with developmental disabilities and other disabilities are allowed to have a support person, usually a family member, in their hospital room at all times and in the ER. But we know that hospitals don't know about this directive, and you'll hear a story today where that didn't happen. The staff they're worried about hospital staff not being trained and not being patient enough to take the time they need to work to have that patient with a developmental disability. They have no communication support in a hospital or emergency room setting. And one self-advocate is afraid that doctors won't talk to me as an adult, that they'll be condescending or even not talk directly to the patient, but to maybe their family member. Many of our respondents, 59%, report experiencing some sort of mental health effect because of the isolation and the stress of the pandemic. Specifically, they mentioned things like loneliness, anxiety, depression, increased challenges with coping, particularly for people with autism who are having more significant behavioral challenges. They're overwhelmed with worry and uncertainty about what the future is going to bring. They want their routine to come back. And one of our self-advocates who responded said that they were sad that they missed their prom and they missed their friends in school, as we hear from so many students. The concerns extend to loss of income for disability families. 38% of households that we surveyed have experienced job loss in their household due to coronavirus. 38% are concerned about having enough money to pay for rent, and 34% are concerned about having enough money to pay for food. This is significantly worse for families who are from families of color, and particularly Latino families. Latinos are much more likely to have lost a job. We're hearing this across the board, regardless of disability. You've probably heard these reports that families of color are much more impacted financially because they're losing their jobs. So they have the double whammy where they're more likely to be essential workers and being exposed to COVID-19. And then the other part of it is that they're also more likely to have lost their job. Families of color are more concerned about paying rent than whites. As you see, the highest level of concern comes from the Latino community. 53% are worried about paying for their rent or mortgage during the pandemic. Families of color are more concerned about paying for food. You'll see that 51% of Latinos, 54% of Blacks, 44% of Asians are very concerned about having money for food, compared to only 12% of whites. And finally, this is our last slide, 40% of Asians report that they feel they're facing racial discrimination due to the coronavirus outbreak. We've been hearing this from other surveys from the mainstream media, hearing that Asians, because of certain ways that this pandemic is being called by our national leaders, that they are facing concerns with racial discrimination. So I am now going to stop sharing my screen, and I'm going to look at, see if we have, I feel like we have a question. Oh, so someone just had a quick question about self-determination being flexible. Yeah, so thank you. Yes, we please join our mailing list so that you can become part of that that process of us advocating to expand the self-determination program. So we're going to move on to other speakers right now, but we'll continue to monitor questions. By the way, this slideshow that I just gave, plus the slideshow that you'll hear from the State Council, will be available on our website, so that people can go through it on a more individualized basis, because I know I rushed through it because we have a lot to cover in our webinar today. So moving on, I would now like to introduce a couple of family members who are going to put that human face on those statistics that we just provided. And the first person I want to introduce is Jean Gottlieb. Jean is a parent, and she has been facing a lot of really significant challenges. So go ahead, Jean, I'm going to, oh yeah, I unmuted you, and go ahead and please present.
Oh, thank you. And I'm a little bit challenged technically here. I don't know if I'm looking into my phone.
You look great, Jean. You look good.
Anyway, I don't know where to look because I've got a computer there and a phone here. But anyway, basically, I want to say that we've had a terrible year, even before COVID-19. But I'm speaking as a person who is very educated, articulate, and I'm aware that I'm in the minority there. So hopefully I can speak for other people who are not speaking today, and saying that there are certain things that Regional Center could do better. And in my experience, it's just been very difficult. And I'm assuming that the challenges I've encountered with them are not unique to me. So I will give just a brief background on just our family situation, which is that I have a child who is a member or client of Regional Center and has been for 10 years and 8 years. And but the beginning of the fall last year, my husband got terribly ill. Operation went awry, and he ended up in the hospital for 5 months, and then came home, and has been home since January, facing major surgery and 6 to 8 weeks to remove his stomach as a result of the surgery that went wrong in September and August last year. So it's been a very challenging year. We also have my mother, who's 96, who lives with us. So we have, basically, I take care of 3 people with disabilities, which has been challenging enough. And then COVID-19 hit. And what that has required me to do is to prevent anyone else from entering our home to assist in caretaking. I know that I'm not alone in that. And the issues that I have come across with Regional Center, and actually we have a good one as they go, apparently. There are some great people there, but some of the systemic problems include operating on a need-to-know basis. So there are, if you're going through a challenge, you may mention this to your service coordinator, but unless you specify exactly a service that you need, it isn't necessarily something your service coordinator will offer. I think that's huge. There's all these hidden services that are not discussed. I'm assuming because they cost more than your basic services. But for us, knowing about them would have been and would be a huge help in our situation. So the response in general with Regional Center is not how can we help, but prove to me that you are truly needy, or prove to me that you are needier than everyone else we take care of. And that is a huge stressor, because it automatically puts me and people like me into the position of having to defend ourselves, being very aware of other families who are worse off, and turning tail and running and saying, oh, never mind. So I think that's the first thing that Regional Center could do differently. Instead of saying, have you exhausted all your other possibilities? Saying, have you heard of this service we offer? I think we can help you. Instead of having a culture of suspicion and withholding of information, there should be concern, creative thinking, teamwork, and transparency. Instead of a culture of no, and why can't someone else do this? Why can't a family member? Why can't IHSS? Why can't the school district? It's, I'm assuming you've exhausted all your other possibilities. Let's see how we can help. And that is my fundamental problem. That this is a service, this is supposed to be helping people, and instead it's challenging people to defend their needs over and over, calling them up before committees, requesting them to write letters when many people can't write very well, and making them jump through hoops to the point where they give up. It's a war of attrition. It's, we can fight you better than you can fight us. And it's really unfortunate, because that's not what this agency is set up to do. So those in general are my issues. The other thing that I don't like is that there's this constant request for more data, more information from us, to the point where really a family is asked to give up all dignity and to give up all privacy and to give the benefit of the doubt to the people asking the questions, that if they give up this privacy and give up this dignity, they will get help. And so many times it's happened that the family will bare their souls and still get denied. That's the gist of what I wanted to say.
Thank you so much, Jean. That, your story is so compelling, and I know I've been talking to you the last couple of days about helping you get some additional support. This culture of no that you talk about is something that we at Disability Voice United have been tracking for a long time, have written reports about it. We believe it is one of the contributors to racial and ethnic disparities. This culture of no is not just for people of color, as you are showing that anybody can experience this culture of no, but it just compounds it. It's so much harder for people to be able to get past it, and who have other crises going on in their household. And so we wish you the best.
Thank you.
I know you may have to get off at some point, but please stay on with us as much as possible. Jean has to actually get on a call with her regional center to try to appeal for some of these services at some point this afternoon. So, please stay on as much as you can and participate in our discussion. Thank you so much.
Thank you. I have to say that it's always a risk for me not to be downstairs dealing with things. So if I jump up and leave, it's because something's going wrong. And I'm not alone. I know that.
We get it. And our next speaker, Dora, if you can stay for a few minutes and listen to her, is in exactly the same situation, in a totally different city, in a rural area, in a different part of the state, but experiencing the exact same thing. So Dora, I'd like to introduce you now. This is Dora Contreras, is one of these incredible grandmas who has brought her grandson, who she's the primary guardian of, brought her adult grandson into her home from a group home during this COVID crisis, so that he doesn't get infected, and it has not been easy. So please, Dora, you need to unmute yourself, but please, Dora, present.
First of all, I'd like to say to Jean that you're very courageous for saying everything that you did, because as you stated, every issue I could identify. And I'm sure that many people listening to this webinar can identify, and our heart goes out to you. We're in this together. My grandson is 27 years old. I'm his grandmother, but I'm his primary caretaker. My son happens to be in denial of everything around him. That happens with a lot of our family members. I'm trying not to cry because of Jean. I'm bringing all this up. It's just like, okay. He's been a client of VMRC for years, since he was 2 years old. And
That's to explain what VMRC is, Dora.
I wasn't supposed to say that. Valley Regional Center. Yes, he has been a client of theirs for 25 years. I've had him in care homes in and out. First, because I worked as a full-time principal of a school, and it was very difficult for me to care for him. He has a diagnosis of ID, intellectually disability, and epilepsy. And as a result of his lungs being scarred throughout the experiences in the care home, the first care home, he acquired tuberculosis. I took him out, kept him for a while again. Then he went back into another crisis, and I mentioned crisis home, where his teeth were chipped. So I took him out of there. And so periodically, 4 care homes where I have just felt I need to get him back home. I haven't been able to successfully do that because, of course, just if we start talking about the COVID coming in, it just makes it 10 times more hard, a challenge because of the fact that you can't get people that will work for the amount of money that they're paid. So I took him out of this last care home because of the COVID. And it was hard for people, some people in the family, to understand, well, why didn't you just leave him there? Well, hello, I'm not going to leave him in a group setting. I'm not going to sleep at night. I am not going to be able to forgive myself if anything happens. I have raised this young man since he was 3 years old and given to me legally. So I am his parent. So my first question from my coordinator, from the service coordinator, was, why, Dora, why did you take him out? And I just got really silent, and I said, well, let's just put it this way. If it was your son, would you keep him there during this COVID? And there was silence on the other end, no answer. And then he said, what can we do for you? So he did respond well. He got me a list of people that I could have help me in the home. And he also helped with signifying that I could use a personal assistant rather than trying to do anything else. So anyway, so in coming out of this care home, he lives in the country, which is, I know that Stockton seems to be the country, but not really to us. The country is like out there in the outskirts where there's horses and cows and so forth. And that's where my grandson usually leaves. So when he lives, so when he elopes, that's where he just goes out with the cows or the horses, or just the neighborhood is a place where it's isolated. So I bring him into my neighborhood, and of course it's very stimulating. He's a very social guy. I brought him home on March 19th, and I've been through 3 personal assistants so far. One lasted a week, another lasted 3 days, and right now I'm fortunate to have a young lady that's lasted a month. So when you think about the group home and its supports and the supports that some of my colleagues, I'm also a member of the ICC group that advocate for people like Latino people like me that have to be educated about the VMRC system. And it wasn't until, or the regional center system, and it wasn't until I got involved with this group that I really learned a lot about the services. As Jean said, some of them are secret, and you have to be in the system to be able to know what those services are. So basically, I've had difficulty keeping staff during this time, and usually it's 1-to-1, and I'm the second person, so it's 2-to-1. So I'm also involved in his care. In the group home, we got 24/7 supervision. At night, I'm by myself. He gets up between 4 and 5, sometimes 3. And I've been able to get one wonderful person that'll come in at 4:30 a.m. and help me out a little bit after he's been up. So during this time, he's had 3 major outbursts, behavior outbursts. The one that was the worst one was led to a behavior that got him arrested by 2 police officers, handcuffed and thrown in a police car. That was a traumatizing experience, not only for him, but for me to watch all of that. The way that happened is he escaped out the back door, and the caregiver was not aware till about 5-10 minutes later. By the time she got out, there was an incident 3 houses down from us with police. They were investigating something, and he has had such traumatizing experiences as a toddler with police officers that whenever he sees one, he attacks them, and that's exactly what he did. So basically, he ends up in the interesting thing about all this is now that I can talk about it, because if Judy had asked me to do that the day of the incident or the next day, I would not have been able to do this. But I can do it now, and I hope it's learning for people that I'm talking to today. The protocol that they followed was they were to take him to mental health. But when they got to mental health, they found out that he could not access mental health because he was insured through Medicare. Medicare being primary, secondary Medi-Cal. So literally what they did is took him from mental health and did not inform me that they had done that. I was got there a little bit later and found out that he wasn't there, maybe 15, 20 minutes later, not much later. And he was taken to the emergency room according to the mental health people that were there. And the interesting thing is they didn't know which emergency room. There are 3 hospitals. So basically I went on the fact that they pointed this way, they went that way. And so I knew there was a hospital that way, and that's where I went. That's the only reason I knew where he went. I was not told where he was going. When I got to the emergency room, of course, they have COVID-19 protocols in place. I was allowed only maybe a yard from the door. As I walked in, I had my mask on. And by the way, something that really bothered me is that none of the police officers had masks, gloves, nothing. And when we were standing there and he was in the car, 6 other police cars drove up. And they all huddled in a group talking about what they were going to do, and no social distancing. So I just, I took note of that. And I said, oh, wow, okay. No social distancing, no gloves, no masks, okay, whatever. And so in getting to the emergency room, the lady at the front desk was very rude. There were 3 people doing intake, and she said, could I help you? And I more or less told her what had happened, and I could hear my grandson hollering because the emergency room was just very adjacent to where we were standing. And I said, that's my grandson. I need to go there and calm him down. I know I can calm him down. By the way, I said the same thing to the officers. By the time I got to the car, it happened so fast that they would not let me talk to him through the window. I couldn't hear him. They couldn't hear me. I said, can you open the door? I know I can calm him down. You can just help me get him to the home. And they said, once the door's closed and he's in the police car, we can't do anything. So basically all of that was just adding to the trauma. At the emergency room, same thing. I had the medications because he takes medications, psychotropic meds. I had them all bagged up to give to the intake and say, he needs to take this. It's time for him to take these. And she wouldn't take them. Says, oh no, he'll be given something. I said, no. He needs to be on his regime, his medication regime. And she wouldn't take them. And she said, well, I'll have to talk to the nurse in the back and blah, blah, blah. And so she said, you need to wait in the car. You can't wait in here. And so I said, okay, but I really need to go in and calm him down. By then I'm crying and she's very rude to me. And I finally looked at her and I said, do I look like I need to be scolded right now? Does it look like in my state and my grandson's state that you need to be yelling and scolding me like that? And then she got real quiet. Somebody else took over, which was a little bit more empathetic. And he said, ma'am, here's a card, call the emergency room. The head nurse will talk to you. As things go by, you'll find out what the status is. So then I said, okay, I waited in the car, an hour and a half, no call. I go back in and I said, I haven't heard anything. And the young man I addressed myself to, I did not address myself to the same woman. I addressed myself to the young man that had been nice to me. And he said, oh, ma'am, it's because I'm looking on the computer and they haven't done anything yet. So there really is no update. And I said, oh my God, I just want to know, this is the worst place he can be right now with COVID-19. And his lungs are scarred and he's going to be susceptible, blah, blah, blah. And then he said, well, we do have them separated. And then the lady that had been rude to me looks at me and says, well, he's in the best place of the 3 hospitals. You should see the others. And that made me feel real good. And so, it was just one thing after another when I thought to myself, this is not what should be happening. This is not the way a person should be treated right now. And if I was treated that way and I speak English and I more or less sound educated, formally educated, then what is happening to other people? I'm thinking to myself this whole time. And basically what happened then is that they finally took the meds when I insisted, but then the next day I had a very, can you hear me?
Dora, we can hear you, but we lost your video. Oh, we lost Dora completely, didn't we? Oh, it just, all right. We're gonna go back to Dora when she goes back in. Ed, if I can have you make sure that Dora is able to get back in. And we'll go back to her and when she gets back on and to continue to tell her story. But since we still have you, Jean, I just want to read a question or a comment that somebody wrote in the chat in the Q&A. First of all, I want to thank you for every single word you said. I am in tears because it speaks so personally to me and my son. One of the powerful points you made that is critical to our community is how do we get information out to families and consumers, especially with the new directives, services, and supports that are put in place to assist consumers and families. Could DDS or ARCA or some other entity put together videos that explain what the directives and services mean and how we can access them? It could be distributed to all regional centers, and this would benefit not only consumers and families, but also service coordinators and regional center staff, so everyone understands exactly what they need. It would be a more cohesive way to understanding what is available. Thank you again for sharing. So, you know, Jean, I don't know if that's something you can answer, but if, you know, what is a better way? I guess the general question is, what is a better way for us to get information to families like yours on what is happening, what kinds of services are now available, what unique opportunities exist through changes in regulations? Oh, you're on mute, Jean.
I'm sorry, something happened.
Okay, Dora, we just went to a question real quick to Jean. And we will go right back to you and to finish your story. Okay, go ahead, Jean.
So just speaking to that in terms of services that the regional center does provide but never talks about, it's as though you have to, you know, in the fairy story, you have to have the right incantation to unlock the, you know, trap door, to unlock the genie or whatever. I'm mixing metaphors. But unless you ask for a specific thing, no one's going to volunteer it. So I mean, clearly the reason is because of money. So unless you're someone, I'm losing my battery here. Oh shoot, hold on. Hang on one second. I got to do something, and can you go on without me and I'll.
Yes, go. Okay, so let's go back to Dora. Sorry about all the technical issues we're having today, but this is the new world we live in. So Dora, you know, you were leaving off in the hospital. I want you to kind of wrap up a little bit on your story. You know, were you able, I guess the question is, were you ever able to get in and support your grandson inside the hospital?
Never, because what I have to say next is a teaching experience for everyone. The next day, because my grandson was not given his medications all day long at the hospital, but given Ativan to calm him down, the next day was horrible for him. He was unregulated. It was horrible. So I said, I'm calling VMC. I hear everywhere about a crisis team. So I called the crisis line, and I was able to get some, which is good. They answered right away. And the crisis line meant, after I described everything, was two things. Number one, that they could send extra staffing from this agency that they contract with. But she had to call to see if there was extra staffing. There was no extra staffing. So basically, it was just one person with me alone. The other part was that I could, because of the fact that he had not been given his meds, I didn't know whether I should start him again on the same regime, or because of the Ativan that was given in the hospital, I didn't know what was causing him to be so wide-eyed and just all over the place, worse than he is. And so they said, well, you can call the chief clinician, which, you know, I was able to do. And basically, she talked to me about how it would be, okay to go ahead and start him on his regular regime of medication. So that's what I did. I think the trauma, in addition to the deregulation because of his body, because of the medication, and of course, I also was traumatized, and so I'm surely not at my best either, with lack of sleep and everything. At the hospital, oh, and the clinician did tell me, she was the one that informed me that she had sent out letters to all of the hospitals notifying them that if anything occurred with a client, that they were to let one person into the room. My question is, again, it's like Jean says, top secret. How was I supposed to know that? I know that somewhere the governor probably did some proclamation, and, you know, with everything that's come down, I mean, it would seem to me that that would be something that the regional center could have made very clear to us during this pandemic. And obviously it wasn't clear to me because I was not allowed. And I think that was part of the trauma that we both incurred that day.
Oh, Dora. But I mean, between your story and Jean's story, it just really breaks my heart to see what's going on. Jean just let me know that she has to get off so that she can fight for her getting her daughter's services at her regional center. Did you want to finish what you were saying before, Jean? Like how we can get information to you in a way that is.
Oh, I think the thing is what they're you know, I'm assuming they're guarding their pot of money. So they're not going to tell everyone who's a client that there are all these services available. They're only going to, you know, let it be known if you ask directly the right, you know, code words. Like I had to the other day ask exactly the right code words, and somebody said, oh yeah, we could do that, but then you have to do X and Y and Z, which is what I'm about to do right now, is go and testify. But you know, is it just money? And if it's just money, then there needs to be more money. For instance, if there are not people who are qualified to deal with our family members for respite, right? Then we have to pay more to find more qualified people, and we have to get people who are trained. Because if we have people who come into the home and do, for instance, ABA for children or kids with autism, and then you have respite people coming into the home for 25 hours a week who are getting paid minimum wage, right? You're not going to get people who are qualified to handle your child beyond throwing an iPad at them and saying, here. And that's what the problem is, that we need more funding, I guess, or maybe redistribution of funding, so that the respite that we are provided, we can actually take advantage of safe and keep our children safe. Because if we have respite caregivers who don't know how to do things with our children, you know, we don't need regular babysitters. And that's the problem. We need people who are specialized, who are qualified, who are trained to be able to create structure for children like mine who need structure, or things will go awry. I better go.
Thank you, Jean. And just I'm going to respond to something that you said that you could potentially use in your hearing that you're going to, is that it is not their pot of money. The regional centers are not using their own money. It's not like they're taking money out of their wallets. Their money is our money. It is our taxpayer dollars. Regional centers are funded 100% by state and federal taxpayer dollars. And so when people say we can't spend our money on that, no, it is the community's money. It is taxpayers' money. So
thank you.
Good luck, team. Keep in touch. Let us know how it goes.
Thank you so much for letting me participate. Appreciate it, and good luck.
Thank you, Jean. Good luck to you. Dora, I'm going to move on because I know I want to give a time for discussion towards the end, and I'm going to move on right now to Erin Carruthers. Thank you, Dora. That was incredible. And I know I have more questions for you at the end. Aaron Carruthers is the Executive Director of the California State Council on Developmental Disabilities. They have done their own survey of the communities that they work in all over the state. They have regional offices, as well as they have self-advocate councils that they work with. So Aaron, you can feel free to share your screen. I know you have some slides and some information as well. Thank you for joining us.
And I'm sharing that. Okay, that's good to know. I thought maybe you had it and were loaded up, but let me grab it really quickly.
I'm so sorry. I always like you to be able to control the slide, you know,
That's
next
fine.
thing. So
Yeah, let me,
get it up.
1 second, I'll grab it. So, I mean, while I'm pulling up the PowerPoint, what I really want to say is I just am so, Judy, thank you so much for organizing these calls, for picking this topic today. I want to really thank Dora and Jean for their stories. You know, when these things happen to us, we're going through it, and we're going through it alone, and it feels like we are alone in it. But the reality is that we're not alone, and having calls like this help us see that and realize it. So I know, Jean, you deeply affected Dora, and Dora, you deeply affected Jean, and as both of you are speaking, you're deeply affecting all of us on this call. So, so thank you for that, and I hope that the people listening are also having a similar experience. So I've got the PowerPoint, and which button do I hit to share my screen? You're on mute, Judy.
Bottom of your screen, it says share screen.
Well, that's easy enough now, isn't it?
Yes. I'm sorry. I did not realize. I could have easily done this, but then you wouldn't be able to control when you're changing your slides. Is it working for you? Now you seem to be frozen, Aaron. Uh-oh, Aaron is frozen. I am going to now get his, just in case he needs to go back out, I'm going to actually get his slideshow up. And I can share it from my screen in case. There it is. I have it. Maybe he doesn't have as much bandwidth as I do. I know that that's hard. Oh, he's gone. Okay. So you know what I'm going to do? I am going to, while he tries to get back in, I'm going to get it up on my screen so that it's ready to go. And Maria, I'm going to have you introduce yourself while we're waiting for Aaron to come back on. So unmute yourself if you want to introduce yourself, Maria, please. Oh, wait, here comes Aaron. Wait, we're good.
Is he there?
Aaron, I've got it up if you want me to share it. Do you want me to share it? Because maybe you may not have enough bandwidth to do it.
I think I can do it. It just dropped me from the call. One moment, but I'm back, and that's good. And let me just close this out.
I have it if you need it.
Here. Oh man, look at us go. There we go. Share screen. Host disabled participant screen sharing.
What? Hold on. All panelists, done. Go ahead.
Share screen.
Go ahead. Sorry about that. That usually doesn't happen.
Share. Here we go.
All right. Great.
All right, we got it.
Rocking and rolling. There we go. Okay. So hello, everybody. I'm Aaron Carruthers from the State Council on Developmental Disabilities. And at the beginning of the COVID crisis, I think you got information from us because as we reached into communities to find out what people needed, people initially needed information. What is this virus? How do we protect ourselves? What do we do if we think we're sick? What do we do if we are sick? What if a family member is sick? So we produced a lot of information within the first month or so. And after that, we realized, okay, people now are on information overload. They're saturated. There's too much coming in. It's coming in from all sources. And even if they could read it, they don't have time for it. There's too much going on. So we paused and we took a step back and we sent a survey out to council members I'm really glad Chair Maria Marquez is on the line today, and she's going to co-present with me. We sent out a survey to our regional advisory committee members. We sent out a chair to the Self-Advocate Statewide Network. And so presenting for you today some of those results. So we were glad to get, with everything going on, we were glad to get a 26% response rate from all of the people that we sent it to. That response was geographically distributed throughout the entire state, so we feel that we have a good broad representation. The map you see on the screen are the state council's regions. I'm sure you're familiar with your regional office. You can see how they break down here by county. One of the things we asked about is, and it's something Judy DVU also asked about, of the participants needing services for them or their families, 13% said they're receiving all the services they need. This is a pretty low number, but also keep in mind this was probably about a month ago is when this information came in. It would be good if we followed back up to see where is this now. 48% are receiving some virtual services, and 35% are not receiving current services, not currently receiving services at all. From this, when we saw this, what we did is we focused back onto the regional centers. Regional centers are the access points. It's where the interface with the community. We wanted to make sure regional centers were having contact, proactive outreach and contact with their clients, just phone calls, emails, something active to find out, how are you doing? What is it that you need? Have your needs changed? Do you have your basic needs met? So really, since we've got this, we've been pushing on that, and we're seeing a better response rate from regional centers. When we asked people what they needed, it was, largely people were just not getting enough information about the crisis. So even though we had produced a ton of information, we're the only entity in the country producing plain language information in English and in Spanish around COVID on a number of different topics for people with IDD and their families, people still believe they didn't have enough information. They didn't know when the crisis will end and how they'll recover. They're in good company. No one still really knows that answer. We asked people, what do they think policymakers should do? We asked people, what are their 3 biggest questions for policymakers? And their responses really broke into a few themes. Many of the questions really were general questions about the pandemic and how it can be prevented in the future. So for example, people wanted us to ask policymakers, what will need to happen and how much time needs to happen before social distancing requirements can end? When will people be able to get back to work? Where do I go to get tested? And how are hospitals dealing with the overcapacity of patients? A lot of these questions still haven't been answered. Now, there are questions that came in because we asked such a broad, open-ended question. What do you think we should ask policymakers? The questions did start to cluster together in themes. So those were general questions, but this is a theme questions where people just had a lot of questions about special education services. What are the expectations for local education agencies to provide free, appropriate public education during the public health emergency, and how are they going to provide the related services that go along with that? When will the California Department of Public Education issue guidelines on teaching special education students and getting them the related services and supports? Are students with IEPs getting their educational rights? And what accommodations will be made for regional center clients and students for whom distance learning does not work? So will there be a collaboration there, or partnership between regional centers and school districts? There were questions that grouped and clustered around the themes for regional centers. How are regional centers monitoring service providers for safety? A lot of questions come up, say for day programs. People who've been in day programs, they love the collegiality. They love their friends there. They miss their friends. But it's a really important question to ask. When would it be safe to return to a day program? People are asking, well, that's the next question. When will my day program or my job that I'm in, when will that reopen? When can I do it? What is the long-term commitment to funding for services for people of all developmental disabilities? In light of the forthcoming state budget crunch, and again, this was a month ago, but it was already on people's minds, and this week we really saw the reality of it. How do we protect our network of services and providers from collapse and preserve the rollout for self-determination program? We're starting to see what those numbers will start to look like for different service providers. It's drastic. It's unfathomable how people continue. I think that question is really phrased the right way. How do we prevent it all just from collapsing? The council's been really clear, and I said this on our conversation we all had last week, which is the focus is on Congress. How do we make sure Congress comes in and supports states across the country? Because without that, these cuts happen. With it, the cuts don't happen. It's very simple, and that's really where our advocacy should be. But the council also, people are asking, how can we roll out self-determination? The council supports DVU's efforts to expand self-determination early to get the people who are on the wait list into the initial phase-in of the program. We think self-determination is going to become even more critical. For every reason that we've always supported the program about putting authority and responsibility within people's own hands. But I also think it just needs to be another tool that people have in the toolbox of getting their needs met, especially as there's such instability with providers. Another cluster of questions around in-home support services. How was the quality care without harm able to be maintained for those in need? If my husband gets sick, who is my IHSS provider? How long will it take for someone to come and help me if I call the emergency registry? How does a person access backup attendant care? What backup services are in place for IHSS recipients and the caregivers are not available? This was right around the time we pushed early on in IHSS that they needed to do two things, establish emergency registries and expedite new providers to be able to provide services within IHSS. We've actually seen a lot of flexibility within that program. They established the registries. They waived the background checks, so new providers can just have a name check by the Department of Justice to be able to be providers. We saw them give flexibility around a family member. More people are home. So the additional family members being able to be providers. So, and then I'm very excited, 2 days ago, the IHSS sent out a notice to all of their providers saying, if you need, PPE will be available to you upon request. So the council led an effort to have PPE available as prevention. We're very specific. Direct in-home providers in IHSS and through regional centers should be allowed to have PPE to prevent the spread of this virus. Right now, I think there was enough supplies so that people could get it if they needed it when there was a confirmed case, when there was a positive test, when someone was symptomatic. That's not acceptable. This is a public health crisis, and the incidence of death by pneumonia is so critical, so astounding. It's the #1 death among people with Down syndrome. The rates for death by pneumonia for people with cerebral palsy, it's 9%. With intellectual disabilities, it's 8% of just deaths without this disease that affects upper respiratory illness. It's an upper respiratory illness. So we've been advocating that there needs to be PPE for prevention. 2 days ago, IHSS sent out notice saying, maybe it was yesterday, that okay, all HSS providers, and we had conversations to see whether or not this can be, similar direction can be sent out through Department of Developmental Services to regional centers. It's a supply question, is there enough PPE? And it's a policy question, who can get it when the supply is there? We're focusing on the policy question. We're seeing more supply come in. Very happy to also announce for you all that we've advocated the State Council can be a key player in getting PPE to people who, to people with developmental disabilities and their family members. Department is thinking, how do we get to regional centers? Regional centers are thinking, how do we get it to vendors? State Council is thinking, how do we get it into the hands of people with developmental disabilities and their families? Very excited to announce that we've been able to acquire 1.9 million pieces of PPE that is being delivered this week to our regional offices. And we'll put out a notice this afternoon telling you how you can get it. I'll tell you right now, anybody on this call, if you want some, email your local SCD regional office. They have masks and gallon containers of sanitizer. We're excited. We even got a backup offer to place a second order. The second order will have face shields. So that may come in a week or so, but we're excited. And I've just, every time I keep going out, how about gloves? We need gloves. So masks, and sanitizer now, and soon we'll have masks, sanitizer, and face shields. So we're excited to be able to get that specifically for people with disabilities. So I'm seeing more come into the system. IHSS is going to have some. The Department of Developmental Services was also able to get the same offer, and so they ordered 3 million pieces that will be going to regional centers. So we're coordinating. Regional centers are getting some, for vendors, State Council is getting some for people with disabilities and families, and we're just going to keep getting it as the supplies come in. Oh, I should have saved that big announcement for the next slide, because the next slide is about PPE. How did the shortage of PPE and ventilators happen, given the policies and procedures should be in place predicting a pandemic? Who can supply PPE for caregivers, family, and other support personnel? Will my assistants and therapists have access to proper PPE? And why are all those still shortages of testing, PPE, and medical equipment? The governor made an announcement maybe about a month ago that they put in an order that will allow for 200 million pieces of PPE to come into the state. And I think we're starting to see, per month, and I think we're starting to see that come online. So we're glad to play our part in getting it directly to you. Other questions in response to the survey clustered around healthcare. How will healthcare for people be rationed? How will death by triage be prevented? For those who cannot get a doctor because they are sick, what can they do? What emergency room services will be offered to the individual with a disability should they suspect they have COVID-19? Why does Medicaid not have a 90-day refill of prescriptions and medical supplies? So the question about rationing still continues. We were glad to be able to get, we asked the governor to issue a statement of non-discrimination in COVID care. He issued that, and then when the details came out about medical rationing, there was phrases in there around life years, and that's not an acceptable standard. We believe it'll be used against us and the people we love, and we've been working with the administration to change that. They've acknowledged that those standards don't reflect their values, but the council's there with leaders like Disability Rights California, like DREDF, like Justice and Aging, who are really leading the legal arguments to get this changed. Also, people had questions around employment. How can the government ensure that people with developmental disabilities who are laid off can obtain competitive integrated employment when employment rates are so high and thousands of people are out of jobs? This is the $38 million question, at least as of this morning, when there's 38 million people who have filed unemployment claims within the last 9 weeks throughout the country. Questions about technology. As we are all moving to physical distancing, how do we reach out? Everybody on this call is lucky enough to be able to have the technology to be able to reach out. How about those who don't? So the questions asked for how do political leaders know who has a Wi-Fi or internet and who may need it? And what's the plan to provide supports and services for people who are nonverbal, limited verbal, who need one-on-one providers due to the severity and need of the technology to even use telehealth, to use telemedicine, to use teleeducation, as everything is moving remotely. So not only how do we bridge the digital divide in equipment, but how do we bridge the digital divide in supports to use the equipment? Questions also surrounded food and housing, basic needs. Can I use and get CalFresh, EBT, food stamps? How could food banks get more food? For the people who cannot go out and get food, how do they have, and they have no one to do it, how can they do that? How can California increase the post-virus supply of affordable housing, especially for people with developmental disabilities? This physical isolation has a toll on many levels. It has a toll just in loneliness. It has a toll for a gap in need. How do we find out what people's needs are? There's a toll that I fear as it relates to safety. As the strain of this isolation goes on, how do we make sure that people, I'm strained, family members are strained, caregivers are strained, and people act in bad ways when people are strained and stressed. So I'm also happy to announce today that the State Council, in conjunction with the Governor's Office, is issuing a public service announcement campaign related to neighbor to neighbor. Your neighbors are the closest people to you. The governor released a neighbor to neighbor PSA campaign related to older Californians, and we've worked with them over the last month to develop one for neighbors with disabilities. So that'll formally be launched on Wednesday of next week by the governor. but I want to give you an early announcement of it today that is happening. So that's very exciting for the governor to be engaged so directly on our needs. So those are the slides that I wanted to present. Our chair, Maria Marquez, is here, and she's going to present the next slides, really about people's experiences and what she's experienced, and also what we've heard from people in our survey. Take it away, Maria.
Hello, hi, good afternoon, everybody. My name is Maria Marquez. I'm the chair of the State Council. That's just one of my hats. I have other hats, but I would have to tell you like a whole book of my hats. But anyways, I do want to thank everybody for being on today. And I'm going to go down the list, and I'm going to talk about my experience as being a person with a disability. So I'm not going to wear my state council hat, but I have signed a lot of letters that went to the governor, that went on behalf of individuals with disabilities and the state council. So I just want to let you know that Aaron really has been on, and he keeps telling me, I sent you another letter, I sent you another letter. So I give hands up to Aaron and all his staff, because they've really been on the letter and the campaigning to help individuals with disabilities. For myself, I was born with cerebral palsy at birth. As I'm getting older, I'm seeing a difference in myself. Like, I mean, right now, a lot of people saying that they're like gaining weight being home. I'm doing the opposite. I'm literally losing weight, and I'm so proud of it. I didn't get on the scale till the other day, and from here to like 2 weeks ago, I've lost 20 pounds. And it's because when I get frustrated and I think about everything that I want to do, I just start exercising. So that's what I've been doing in my life. But I do want to say how the COVID-19 has affected families, friends, and because of connections with disabilities. I do want to say that people can't go outside, and I really feel for those that don't even have staff. I mean, I had to fight for my staff person to be in my house because they said, oh, she can only call you. And I'm all like, what? I'm supposed to be on the phone for 6 hours when I need help physically? I mean, and they go, well, and I said, well, I do take a shower and I need help because I don't have a walk-in shower where I live. So they said, well, she can visit you 2 times a week. And I said, okay. So I tried it for 1 week. I called my service coordinator back and I said, you know, I need to take a shower more. I like to be clean. I go, don't you like to be clean and take a shower every day? And she goes, yeah. I go, can you give me some more days? And she goes, okay. But for everything, they have to call the agency that sends her, right? And they ask me the ridiculous questions, like, are you sure you don't want to do the teleconferencing? I go, no, I need somebody physically here with me. I go, I have gloves and I did buy a few masks, so I do need that. And they said, oh, don't worry, we'll supply you with gloves and masks. So to this day, all I got was 2 masks from them and maybe 4 sets of gloves. And every time I call them and I say, where's my supply? They said, oh, you have to wait till the next shipment. And this is already going like on almost 3 months, I would say. And so, so I called my service coordinator and I said, you know, I go, we need to do some negotiation here. I go, because I'm find myself more alone. My daughter was living with me, but she's at the point of moving out, which is better for me because I told her, if you're not going to help me, because families have been really stepping in, and I give a lot of credit to that grandmother that got her grandchild out of the setting of being in a group home. I think that is, I give all hands up to her, that woman that spoke earlier. I do want to say that she's in the process of finding a place and moving out. So I let Regional Center know. They go, well, we can help you then. So this was going on 2 weeks already. I get a phone call and the agency tells me, so are you sure that you want somebody in your house? all that time, I go, yes, if I have gloves and a mask on, the other person could, do the same, we'll be good. I go out, but I physically need help because due to a shoulder surgery that I had, I can't be picking up heavy things. And I've noticed as I've gotten older, like arthritis has been kicking in more. And so sometimes it's in my hands or it's in my feet. But when it gets in my hands, and I'm very surprised at that I find myself constantly dropping things and then I have to pick them up. I mean, I have my way to do it, but if I had somebody with me more often, it'd be easier for the other person to help me pick it up. But I find myself picking up little things here and there that just fall out of my hands. And I'm thinking, what's going on with me? So that's another thing that I have to bring up to my doctor. So on the slide, I haven't even finished, and I'm sorry, guys. It's so can't go outside. It's very sad when you can't go outside and go sit in the sun and look at the pretty flowers that are out there. Can't spend time with friends, I mean, you can only talk so much on the phone. And as for me, I've been on webinars and I've been on the phone a lot. And then you're actually feeling socially isolated from the world. Feeling more connected by internet platform. And I do want to thank the council because I did have an iPad, but my granddaughter cracked it and my daughter. So they sent me one so I can do council business, but it's only used for council business. So that's nice that I could see Aaron, but I talk to him every day, so it's good. Feeling more connected by the internet. How about behaviors have increased or worsened? Because like you're just frustrated being at home and you can only watch so much TV. Increases or decreases in anxieties or other mental health conditions. And when people are feeling that way, maybe it'd be good if they can call the 211 line and talk to a mental health person, and just maybe that's another avenue so that you can get more support, and they can maybe connect you to a group that they may be like doing the social distancing or doing classes online. I mean, there's a lot of things that are out there, but we have to really look into them. Can't go out or go out to eat or go shopping. So the only stores we really have is like Walmart, Target, and all the other, grocery stores, but we don't really have the malls yet because everything's online if you want to order stuff from the malls. And the thing is that a lot of people that have IDD, don't even know how to order stuff online and may need assistance and may not even have that assistance. I mean, I know how to order stuff online and I do it all the time, but I like to go to the malls because I like to see and I like to touch the material. So that way, if I see something online that's at more cost-effective price, I buy it because I already seen it. But I haven't been to the mall in so long, I forgot what it feels to go to the mall. My birthday just passed like a week or two ago, and my sister-in-law tells me, I want to take you out to eat, so do you want to do it now or do you want to wait till the restaurants open and we could sit down and dine? I go, oh no, I want to wait till the restaurants open because I would love just to sit in a restaurant because that's the fun of it. Because when you go order and you go through a drive-through, you pick it up, you bring it home, you eat it, and it's like really no fun really eating out. Although I have been doing a lot of cooking as well. So that's another thing that I know that people are going through, as well as a person with a disability, family members, parents. And then needs to wear masks and other the PPE, which Aaron was talking about. That is so important because I realized the first time I did it and I wore gloves and they were like see-through white gloves. When I took them off, they were filthy. And I had just went to Walmart, and just by touching stuff, I realized that how many germs are out there. And I was like, wow, this is like no joke. I mean, I'm even washing my vegetables and I even told my sister, I go, I even put soap on them. My sister goes, why do you do that? I go, to get all the germs out. So my sister thinks I'm crazy, but I just, after wearing the gloves that were when I took them off and they were filthy, I made sure to throw those away. And now when I go to the store, I mean, as the pandemic started, I was already wearing and ordering gloves for myself and a mask. And every time I go out, I have my gloves and I have a little thing of hand sanitizer with me in my purse, and I have gloves. Because if I get off the car, I want to be prepared, because there's so many people, and I've even noticed in the store, that are wearing a mask, but they don't have it properly on, and either they don't have it on right, or they have their nose sticking out of it. So that's really not going to help. I mean, people should really think about how many people are in the store, and I know now they're cleaning the stores more, because I have seen that. So I'm sorry if I'm talking too much, but I'm just telling you guys.
Hey, Maria, thank you so
Yes?
much for all the good information about how you're experiencing some of these items. I know we have one more slide that has a lot of information on it, and there's
okay.
other speakers. So if we
I'm
could,
sorry.
thank you so much.
I'm sorry, I'm gonna go down to the next slide.
I'll go to the next slide.
Yeah.
Move it
Okay,
on. There
I'm
you
sorry,
go.
guys. Because whatever I missed
Maria, if
on
you
the
could.
other slide, whatever I missed on the other slide, it's there. So on the next slide, it says, what do you need most right now that you don't have access to in order to support you during this pandemic? Well, household supplies, hand soap, sanitizer, disinfectant, toilet paper, immunization, caregivers, help to keep, help with basic grocery shopping, social interactions with providers, quality with food like the CalFresh, as Erin was saying earlier, online shopping for groceries and delivery, getting your prescriptions delivered, personal protection equipment, and PPE. Additional services, HISSS services and supported living services, relief workers, respite, things to do at home, intervention thinking, electronics, education, having a computer, an iPad, the internet. It'd be good to get a walking companion. Like I said earlier, mental health professional, help with connecting with people, and financial security based on like your social security. So that's the whole list there. And whatever I miss, you guys can see it, because Judy will be handing it out to everybody, and you can get it on the internet. Thank you.
Thank you so much, Maria. There's really interesting stories. Erin, do you want me to introduce Lisa, or would you like to?
Please go ahead.
Okay. Our next presenter is Lisa Utsi. Lisa is the chair of the Self-Advocate Council 6. She's got a very cool backdrop with a giant hand with a glove on it with quarantine. I really like that. Lisa, go ahead. You can go ahead and speak now. Make sure you unmute yourself, or I unmuted you, so you're good.
Hi, everybody. My name is Lisa.
Hi, Lisa.
Hi, how are you? Okay. Hi, my name is Lisa Utsi, and I am the SAC6 chairperson from Modesto. The Self-Advocacy Council 6 has been hosting 4 Zoom calls for self-advocate from Amador, Calaveras, San Joaquin, and Stanislaus County, and Tuolumne counties. SAC6 wanted to check in with the people to see if they needed anything. From these calls, we have learned about unmet needs for adults with developed disabilities. These are many comments, but there are a few highlights of what we have heard. Number one, helping people to not feel isolated. People who live in their own apartment told us they were feeling very stressed out during this virus and felt alone. A lot of people want their day program to open back up because they are missing their friends and their routines. Number two, helping people get communication about the coronavirus in a way that can access and understanding. Many self-advocates don't have the access to Zoom meetings. Non-English speaking self-advocates did not get on our calls. Information needs to be in plain language and in their language. A few people who live in care homes were not on the call, and a couple told us later that they wanted to be but did not have the help to do so. Number three, helping to have service support working together in a better way. Day programs are doing different things to stay in contact with their people who go to their program, and some are not. Some care homes are okay with day program providing services, and some are not. People are confused. Okay. People keep asking us when the day programs will be opening, and what are the rules will be when they do open. Will they have to wear masks and gloves? Number four, working with the regional center. Some people said they have heard from the regional center service coordinators several times. Some people said they had not heard from them. And a few others said they didn't have a service coordinator at the time and still have not heard from the regional center yet. Some people did not know that they could ask for more help during this time from the regional center. Some people didn't even know what they could ask for or didn't want to ask for help. Number five, helping individuals who do not communicate with words to be a part of the conversation for needs of services support with their support team by including plain languages information to parents, agents, and support people. That's it.
Thank you, Lisa. That was really, that list was extremely important, and we need to really try to address all those barriers and all those concerns that people have.
Yes.
There's some questions that have been coming in. These were all our presentations, but there are some questions that have come in, and I have a few in my own head. But one of the questions was, did anybody have any concern about losing their home? And I know that that's because of COVID. I know that that's certainly a concern when people express that they feel they may not have enough money to pay for rent. I think part of that concern is that they might lose their home. Because if they can't pay for their mortgage or for their rent, then they will get evicted. There are a lot of things being done at the city and county level to prevent people from getting evicted. There's also some work on trying to help people with their rent, and even having back pay of rent being paid. I know in the city of Los Angeles, evictions are on hold right now. So it's kind of being done on a city and county basis. Aaron, do you have any other comments related to housing and how that's playing out for people?
I think it's largely in a holding pattern. I know that for me, if I was, my housing was unstable, my income wasn't coming in, and I had protection for some of these, my worry would be what happened when the protection ends. And I think we as a society should worry about what happens when those protections end. are we going to see the spike in homelessness as we've seen a spike in joblessness and unemployment claims?
Yeah, I worry that that is going to happen. Daniel Garcia is suggesting that regional centers provide monthly informational meetings with parents and clients of their services. I think that is an excellent idea, maybe even more often than once a month. I know that regional centers have been asked by DDS to find out how people are doing, and they can choose various ways of doing that. I know that Regional Center of Orange County did a survey of their clients and families, which interestingly found similar results to some of the stuff that we've been finding. And I know that Westside Regional Center last week had a town hall meeting. I think there are ways to make these things more accessible to people. I think their town hall was only 1 hour, and it didn't really allow for enough time of people to express their concerns. But I think that there are ways, and I don't know, maybe it's a good suggestion that we formalize those requests, that maybe we come up with sort of a list of things that we would recommend from the perspective of self-advocates and families that we think could be helpful to get people more services and have their needs met. And we're not just talking about regional center services, but this is the time, because regional centers are the payers of last resort. This is the time for regional centers to be helping families access those generic resources that they're called. It's a terrible term, but it's basically those resources that exist outside of the regional center system, like in-home supportive services or IHSS, help advocate with schools, help advocate with Section 8 or Department of Rehabilitation or other kinds of services that exist out there. Aaron, do you have any comment on that piece of how regional centers should be providing informational meetings on a regular basis?
You nailed it. Yeah, nothing more to add to what you said. You got it.
All right, great. And any of our other speakers can chime in as well. Oh, Talene wanted to know, Talene, and you're going to answer this live. What is the email address to request PPE?
Yeah, thank you. I tried to answer that in the box, but I don't know, it didn't give me an opportunity to type. So thank you for asking the question for everybody. But an opportunity to get some of the PPE, and it'll be on a first come, first served basis, is to contact your local SCDD regional office serving your area. And if you contact them by email address. So each one has their own general email address, and we're going to send out something later today broadly with all those list of addresses. But if you need that now, you can go or just message me, Talene, and tell me what area you're in California, and I'll send you the address. Sonia from our Sacramento office is also online, and she put into the chat to, if you want to look for your local office, just go to the State Council's main page and click on regional offices, and you can find it there.
What's your website's?
scdd.ca.gov.
Okay, got it. All right, I was able to put that in the chat. I mean, in the Q&A. Here's somebody who said that they called IHSS to get some of the PPE and were told that they're not responsible for giving it to us. How do we ensure that IHSS are actually following the rules on this?
Yeah, I think that's accurate. They'll give it to IHSS providers. So first question, was that person an IHSS provider who asked? If they were, then they wouldn't have given it to the public authority, wouldn't have given it to them before yesterday, unless there was somebody with a positive case. So right now, if you call your public authority and you want PPE from the public authority and you're a provider, then you should be able to get it because you've requested it.
Okay. Here's just a quick one. Maria Macedonio wishes you happy birthday. So let's make sure we say that. A belated happy birthday. Here's one for you, Aaron. Can you tell us about the governor's program, Neighbor to Neighbor, for people with disabilities? Will it be for all disabilities? Will it identify people with disabilities specifically and not call us, quote, at risk or vulnerable populations? I'm not sure if you could answer that.
Yeah, the program is for people with all disabilities. It's not specific to developmental disabilities, even though the State Council is is a partner with the governor's office on this. Early on, we produced information about how to stay connected during COVID. What are activities you can do remotely? How can you use phone trees to reach people who don't have access to technology? All of it was ways to support each other. The governor's office really drew on the state council's expertise and resources to build the information for what they're going to be releasing. But it is general. It's for all people with disabilities. And it's going to be informal. It's raising awareness within neighborhoods of, hey, if you have members in your neighborhood with disabilities, look in on them, check in on them, see how it's going, see what they need. So this is another frontline close to you resource of people who are checking in. The good thing about this is that we didn't make it COVID specific. We talked about it to reduce isolation during physical distancing, but the way it's set up, it's really going to come in handy when fire season is on my mind. And when there's a public safety power shut off, our neighbors connected so they're taking care of each other. If fires come along and there has to be a neighborhood that's evacuating, service support personnel can't get there in time, but neighbors can be there to help. So I'm seeing this as a good infrastructure for people in general.
Thank you. Sonia Bingaman, who's from the State Council, wants to let people know that if you do need to contact the State Council's regional offices to get PPE, it's really best to do it through email because these are the physical offices are closed, but everybody is still at work, working remotely. I also encourage those of you who are listening in that if you have stories that you think are good to tell, that are important, that really put a human face on some of our data, please type this in either the chat or in the Q&A, because you all should know that we did not cook this data. This is just the data that came into us. It was analyzed by an independent person who has absolutely nothing to gain from it, who created charts for us around it. There's been some folks who've questioned whether this data is correct because particularly around regional centers, who are saying that they have reached every single person and they're trying to help every single person. What I can say is that this information has been replicated by multiple sources, not only the DVU survey has also been replicated in a different kind of way by the State Council, but I have seen two other surveys that are out there, one in Northern California, one in Southern California, that's of a smaller geographic area that have very similar results. So I think we can all do a better job of making sure that we are contacting people. Another suggestion that I have provided to folks when they've asked is that I think it's important for regional center boards of directors to really be holding the staff accountable at this time. I know it's hard because boards of directors are not meeting in person anymore, and that they're mostly self-advocates and family members who have their own lives, and many of them are in crisis like this, trying to manage kids who are out of school, trying to manage adults who are out of programs. But I do think that this is the time for boards of directors to step up and really use their authority as an oversight body. One of the things that boards of directors can do is to create a set of metrics or ask for a set of data from their executive director, asking, what kind of outreach has a regional center done to every consumer, and have service coordinators check that off, whether it was spoke to them directly by phone, texted them, sent an email. Did you get a response from email? What kinds of questions were asked? Maybe there should even be a script that's developed by the regional center to say, to ask the families. So I can tell you that I have a very lovely service coordinator, but what he asked me was, is there anything that you need? And so once again, we are in that situation that Jean talked about and that Dora talked about, where is the secret code. If you don't know that there are expanded uses of participant-directed services, or have ever even heard of participant-directed services, how would you know to even ask for it? And so, to me, it's really important that service coordinators right now are our advocates. And it also means, if that this culture of no has to change. So what culture of no might mean is no but. So maybe the regional center cannot fund that particular service you need, but they can go out and help you get it from another source, because you wouldn't be asking for help if you didn't really need it. So I don't know if Dora, if you want to, comment on that, or any other suggestions you would have of the way that regional centers, could provide help in a little bit better way. Oops. Okay, go ahead. Start again.
It's really difficult to really talk about this.
You're on 2 spots. Oh, I know why. You are, hold on a second, Dora, because I actually saw you as one of our participants. So I'm going to remove you as a participant and it should work. Okay, go ahead, Dora. Go ahead and speak, Dora.
Yes, it's hard to say during this time, but I work with, as you know, for the ICC community, and there's different challenges to everything because of the fact that we work to educate people in the system. And so if we that are informed, and I'm talking about myself, about the system and how it works, you can imagine what's happening to people that have no clue. And so I would think that the regional center could make a bigger effort to connect with these people, with these individuals that we work with, by connecting with us and collaborating with us. If we are there to speak to the grassroots community, because we are working with the grassroots community, then they should be contacting us. They should be contacting me as manager of this area and saying, Dora, do you know of any families that need help that have not been able to get services? I think that we really need to speak to leaders in the area, because we have a population that's underserved and is in disparity.
Mm-hmm. Thank you.
We can't get to the community unless we get to the leadership and the organizations like the ICC who works with people in the grassroots community. This is why I don't understand, something I really don't understand about the regional center, why they don't see us as partners. We are partners. We want the regional center to provide services. We want to educate our people about those services. We want to utilize those services that are, as you said, Judy, they are our services. Mm-hmm. It's our regional center.
Yeah. It belongs to us, the taxpayers.
Exactly. No. I'm a taxpayer, you're a taxpayer. We're all taxpayers. And so I would just say to the regional center, and especially my local regional center, is we want to help. We want to collaborate. We are not in competition. There is no competition. We're reaching those people that are in disparity. And we would like you to reach out to us as leaders, as a group, to say, tell us about these people that need help and need these services. I don't think that's hard to do, Judy.
Right. I agree. So we're going to start wrapping it up. I want to open it up if anybody else has any final comments today.
I do.
Go right ahead.
I just want to tell Aaron and you guys, thank you for having me on today.
Thank you for coming, Lisa. We really, really appreciated your comments.
Yes, you were awesome. Good job.
Yeah, really.
Good too, Maria.
And thank you, Maria. Really appreciate it. Aaron, do you have any final comments or anything that you wanted to? Okay. So I just want to tell everybody that, this next week is going to be a very critical week for our community. We are working very hard on advocating for a budget that is still going to protect the most vulnerable in our state. We really appreciate all of your support out there in working towards these important goals that we have. We will be having another webinar next week. No date or time set, but it's going to be looking into the future. Now that things are starting to open up, I can tell you that restaurants are starting to open up. Indoor restaurants are starting to open up in certain pockets of the state, and shopping malls may be opening up within a week. is Memorial Day weekend, and people with disabilities, how are we going to manage this? How, you know, we want to be part of the community, but are we going to be segregated because we are vulnerable and can't be experiencing some of these openings? So we're going to be looking at sort of the future, what kind of guidances we can use for ourselves, as well as what can we ask of our community to continue to protect us. So thank you all again for joining us, and we'll see you next week at our next webinar. Take care.
Thank you.
Bye-bye.
Thank you. Bye,
Thank
Judy.
you.